Hello, it's McKenzie here again. You can notify me as a carers activist, I suppose. What I do is raise awareness of unpaid carers, specifically those who are caring for a close relative living with mental illness, or perhaps even living with cancer. And my focus is to raise awareness, help educate, share my story regarding what can help unpaid carers out there. And even if you're not caring for someone with mental ill health, you can still take some things from my video lectures or my blogs, a Care in Mind, and I'll put descriptions of those resources in the video description. However, this video lecture, is more focused to those who are caring for someone with mental illness, living with mental health needs. You would have some examples: psychosis, schizophrenia, self-harm, eating disorders, bipolar, that type of thing. And obviously, when you're caring for someone, it's only a matter of time. If they're using secondary services like NHS mental health services, they will be provided a care plan. And as a carer, you would need to be involved or seek to be involved. I'm sure you would seek to be involved, obviously. Not always easy. It does depend on the consent, obviously, of the cared for, of the person living with mental ill health. But if you are given consent and you begin to get involved when it comes to the care plan, what do you expect to see from that? And obviously with this lecture anyway, this is going to be some of the most generic things taken from care plans I've come across. So let's begin. So what to expect, basically, as a care plan I've mentioned, it's just it's basically aimed at someone with mental illness. It's just a set of guidelines that outline specific strategies, treatments, and support systems in place to help your loved one manage their mental health. A good care plan, though, also has information, a bit of information about yourself and a bit of guidance as well. Obviously, not all care plans are going to be the same. They're all going to be different depending on the condition or the diagnosis of the person living with mental health. But as mentioned, if you're caring for them, if you're next to kin or the close relative or the chosen person to support and help guide them to some form of recovery, then the care plan is key. And before you even continue, the person who has been given the care plan should definitely have a copy, and yourself as well. But I mean, before I do continue, one of the most important things about this lecture is obviously the care plan is a form of guidance and guidelines and a set of strategies. But there's times when you might want to question what's on that care plan. I mean, a rubbish care plan could be, there's a one page. Obviously, it's got to start from somewhere, I admit that. But as you go along, when you're caring for someone, it's going to be a lot more than that. And what you don't want is things missing out of that care plan. So that's the number one reason I've decided to do this lecture, to help families and carers who are caring for someone living with mental ill health. And as a carer, I've mentioned it's got to be well designed, so it can help you understand the best ways to support the person you care for, and also set realistic goals. You don't want everything up in the air. You want to know what you're doing, and the person with mental illness wants to know how they can cope and focus more on recovery and get access to resources. And it should address both your needs, not just the person living with mental ill health. So, as mentioned, I've gathered the most generic of what I see in care plans. As mentioned, though, taking a closer look, they're never all going to be the same, but you might find the most common things out of this lecture that will be situated in a care plan. So the first one, and probably one of the most important things, is you've got to know what you're dealing with. And it might be titled in that care plan, assessment of the individual needs and symptoms. The reason why I personally feel is most important really is if you get a wrong diagnosis, the whole care plan falls apart because basically you're trying to set a pathway on how to support someone with a wrong diagnosis. So to getting that diagnosis right is, put it in red, is absolutely vital. As mentioned here, the care plan typically begins with the assessment of the mental health needs of the person you're caring for. So, someone's wrongly diagnosed as a self-harm or bipolar, when actually from living with psychosis, then the symptoms and challenges and recovery pathway begins to fall apart. But a good care plan will have a lot more information about that diagnosis. Something you can always again query if you're not sure, or obviously the care plan that was drawn out for the service user patient, again, they can query if that is the right diagnosis. So information about the primary symptoms and the related challenges that's not being picked up. And this is really important what I'm going to say. Because you know that person best and you don't see certain things in that care plan that should be there because you're living with them, or if I imagine you are, it's not always the case. There's certain things you could all sort of say in other related challenges, mood swings, anxiety, social withdrawal. What other things should be in there if in agreement with you're cared for? In this part of this assessment, it should also cover factors that impact mental health. Not all families are the same, so there will be family dynamics. What, who is the next of kin, or who's doing the most of the caring, if they have anyone at all, who's a dependent of the patient, social stresses, work, addictions, anything like that, lifestyle habits. What can be triggers? What can cause issues? What could help? And that probably will come later on down the line with this care plan. But in the end, this helps both you and the mental health professionals better understand factors that contribute to that condition. What are the triggers? And that's what they're usually named as. So that section 2 of usually a care plan, it might not be in this section, it might be later on, but do remember it's got to be in there. This is again why I'm doing this lecture. The care plan should include specific treatment goals that align with the individual's mental health needs. And these goals might involve reducing specific symptoms, improving mood stability, enhancing coping skills, or building social connections. And one of the things about this care plan is that obviously there may be a focus on medication. We'll get to that in a bit, but there also should be a focus on what else is out there, referrals to specific resources or groups or forms of education. So what's really important here, and I'll put it in bold, is treatment goals are usually designed to be achievable. If they're not achievable, again, the care plan falls apart, and you know that person best if you're caring for them. And it should be measurable so that progress can be tracked. This is really tricky though, because what tends to happen is perhaps 6 months down the line, you're called back into a care plan approach meeting. And I can't imagine many carers out there measuring if that care plan's working. I mean, how is that possible? You can only measure what you see when you're caring for someone, but you have to try and stick to that care plan. And in between those 6 months or a year, do not expect to just go away with that care plan and hear nothing. It's really important you keep in touch with the, let's say, community mental health team or the consultant psychiatrist assigned to your loved one, or even the GP. Now, those goals, they might include regular attendance at therapy, developing routines, or using successful coping strategies. And these things will be brought up in that care plan. If something's missing, do take the time to mention that at a care plan meeting. So here's one of the things that would be really useful. As I mentioned, it shouldn't be just down to just medication alone. There will be a section, hopefully, on therapeutic interventions and strategies. And if not, then ask why. But if there is a section, as mentioned, expect a breakdown of therapeutic interventions such as CBT, cognitive behavioral therapy, or DBT, dialectical behavior therapy. And there are other recommended therapies tailored to the mental health condition. The plan also may indicate who provides these services, as I mentioned before, your loved one or the person living with mental health, referred to those services like a long-term psychologist, psychiatrist, or even a counselor. Within this section, though, it also includes specific strategies you can use to support your loved one during challenging times. And this could be practicing grounding techniques, encouraging a routine, or even facilitating relaxation exercises. Another thing you can also ask for is communication strategies in forming that relationship with your loved one if they're living with a mental health condition. I think, well, personally, myself, I think communication is key. Learning to communicate de-escalation regarding if you're living with someone with mental health needs is vital if you want to try and keep towards that care plan as well. And this is a bit when it comes into medication. Not all care plans may have this sort of thing, but I think a large number will. So if there is medication, if that's part of that treatment, then it's very important the care plan should detail that type of medication, the dosage and instructions for administration. I highly doubt that you'll be given the medication, depending on the condition. Usually the patient or service user, if it's oral medication, will more likely take it themselves. If it's a depot by injection, then it's more likely a trained mental health nurse will be administrating it. What's really important, though, is it should also provide guidance on side effects to watch out for, or any interactions to avoid when to contact the healthcare professional if that issue arises. So it's really important that if the person that you're trying to care for and support, you keep an eye out for the side effects. And if it's not mentioned in that care plan, then now's a good time really to ask about what side effects you should be looking out for, whether the dosage is quite high. And this is something I'll cover in the following lecture. And I've mentioned, I've skipped ahead a bit, rushed ahead. You are responsible, really. Well, not really you. You should really be the patient, but you play your part. So you may be responsible for monitoring medication adherence if they take it, not just the side effects, but if they're taking it, if it's oral medication, as you can see from the picture I've put here. And observing any mood or behavioral changes that could indicate a reaction to that medication. So this section here, crisis intervention. As mentioned, mental illness can sometimes lead to crisis, such as severe depressive episodes, relapses, panic attacks, psychotic symptoms. The care plan should at least include a clear crisis intervention plan with steps to follow if your loved one's mental health suddenly worsens. And usually in this section, it will include like emergency contact. Now, these are usually known as emergency plan, crisis list. Usually there must be named people on their mental health crisis teams, psychiatrists, hotlines, and it can also provide coping techniques for immediate support or any instructions on when to seek urgent care. You don't want to be sort of a deer in headlights when you feel a crisis is happening. To avoid situations when things get out of hand, it's best to act quickly and to act quickly, it helps if you have a plan. And this is the whole point of that care plan. So daily routine and structure, obviously in that care plan, if there's routine, that can aid immensely in recovery. And it's particularly beneficial, again, for someone living with a mental health condition, Providing structure and stability, the care plan might outline daily routines or recommended activities. Obviously exercise, promoting well-being, sleep patterns, balanced meals to eat healthily. That's really important because there's some medications out there, antipsychotics, that will put on weight for the person living with the mental health. So that's why I've mentioned physical activity. And also time for relaxation as well. Not all of these things are going to be put on there, but it's something you might need to raise if the care plan's been drawn out. As a carer, one of your roles is to encourage the positive habits and offer support in maintaining a stable and healthy lifestyle. And as for you as a carer, resources may include, and I've mentioned at the start of this lecture, they should include care support networks, forms of respite care, or community programs that actually help reduce the caregiving stress or caregiver burnout. Being aware of those options actually provide a foundation of support for both you and the person that you're caring for. So now we're entering a section regarding support services and community resources. So the care plan should really list local and national mental health resources and support services available for both you and the person that you care for. They might include support groups, outpatient therapy, day programs, vocational rehabilitation services. It should be listed with contact details of where you can go. And you're not compelled to use them, but do take note. And if it's missing on there, on that care plan, and ask what could be provided, even if it might be on a separate form, a separate leaflet. I've mentioned the relapse prevention strategies, and these will probably come under that title. It might not be titled as relapse prevention, but there should be something on there where many mental conditions, unfortunately, have periods of readmission, relapse, and it might be down to adherence to medication. The care plan should include relapse prevention strategies, such as warning signs to look out for. You might not know that as a carer. You're not really the professional in that sense. And there's no reason, again, you can't ask, what should you be looking out for if a relapse is coming on? It could be giving some examples of withdrawal from activities, changes in sleep patterns, an increase in negative thoughts, something you need to look out for. Now, these signs allow you as a carer to intervene early, hence early intervention, and seek help if needed, potentially preventing that full relapse, because what you don't want is someone, unfortunately, has fallen under the situation of mental ill health. But there's at that point in time, because the strategy wasn't followed, or it couldn't have been followed, or wasn't there, you're sort of stuck, and you're now waiting for support services to help. So in that relapse prevention strategies, it should include steps for managing increased stress or life events or triggers that would trigger symptoms. In this section, self-care and wellness practices, the care plan should encourage your loved one or the person that you're caring for on self-care practices. You as a carer, you can't do it all, and you shouldn't be given that task. There should be a form of independence for the patient. And this could be mindfulness exercises again, and the care coordinator, social worker should drop in and ask about those things. It could be journaling, engaging in hobbies that promote well-being. And these can be simple practices, but they actually are vital for mental health and resilience. But you can also help incorporate these activities into your loved one's daily life, creating a supportive environment for their self-care routine. And again, if you're not sure, do ask when the care plan's being drawn up. Ask the mental health professional. Now, I've mentioned earlier on in this lecture, I did say communication is key. And in the care plan, there should be communication guidelines. So some mental health conditions can make communication challenging. The care plan might include guidelines for effective communication. Hence, I did mention de-escalation techniques, and there's lots more out there. So outline ways to talk to your loved one calmly, avoid triggering language, and try to use positive reinforcement. These things you're not going to just pick up. will probably need some type of training, which you should try and ask for. Communication guidelines can also include active listening strategies, which can help build trust. Again, very vital because of if communication doesn't go quite well, relationships can fall apart. When relationships fall apart, then trust begins to go by the wayside. So the point really is you want to help keep building that trust and a safe space for expressing those feelings. Again, don't expect to do this all by yourself. There should be forms of peer groups available for your loved one. Other part on the care plan should be setting boundaries and managing expectations. The care plan may address how to establish healthy boundaries. The reason for this is you don't want burnout, really. You don't get care of burnout. You don't want to be too much put on you. So it's so important to set boundaries for yourself so you can manage those caregiving relationships. And this might involve setting clear limits on time and emotional availability. It might not actually be in that care plan. It might actually, most of it might actually fall on the carer's assessment. But you don't want to be overwhelmed or burnt out. And again, one thing to note in the care plan meeting is you don't even have to mention it then if your loved one's there. You don't want to embarrass them. You might even have a word outside that meeting to say, listen, I don't want to be overwhelmed. You might be working, you might have other dependents. What can you do to manage setting boundaries? So the point of care boundaries is they are beneficial for you. Again, if you don't be put upon, it's not your fault these things happen. It's not their fault most of the time. You want to maintain a respectful and balanced relationship while preserving your own well-being. Failure to do that risks mental health for yourself. So it's really important to take note of these things. And now we're coming now to the review and update on the procedures of the care plan, whether it's working. So a care plan is a dynamic document, not a static document. It will change and it should be reviewed regularly to ensure it reflects current needs. The sad fact with care plans, and I'm being realistic, is over the years they become a bit more heavy if recovery is becoming an issue. And I'm just being realistic, but it still should be there. Expect a schedule for updates, and this could be involving check-ins with mental health professionals to assess progress and make adjustments. I'm not being a doom and gloom. There are situations, care plans will improve the situation, and hopefully your loved one's on the road to recovery, but again, with your support. With this dynamic document, we'll note changing medication, changing the doses of that medication, different forms of therapy, or even the personal circumstances could change. We should trigger a review to adapt the plan as needed. Again, I'll give an example, financial situations causing triggers, lack of access to help and support. So you might ask for the plan to be reviewed, or even better, they might ask. So how do you make the most out of a care plan? So I think you put down 4 or 5 steps to fully utilize the care plan. Consider these practical steps. So as a carer, and I did say this at the start of this lecture, there should be a copy for your loved one, the person living with mental health, and for yourself. And don't just be given the care plan and put it in a drawer and close it. Study it, familiarize yourself with the strategies and resources outlined. Usually care plans maybe a couple of pages, and if that's the case, I think that's a good thing. The more that's on it, the more you know what to deal with. I'm not saying they're 100% right. You can always query things in there, but the first and foremost is stay informed, so you know what you're caring for, you know what you're dealing with. The other thing is to take notes, especially during the meeting. Take notes on anything regarding new symptoms or changes in behavior, or even if there's progress. This documentation, the plan can actually help the plan when it comes to reviews. One of the best ways is journaling, to be honest. I always say to carers, keep a caring journal around, and use that as a way to query or help form that care plan for the future. This also aid with the mental professionals on decisions they make to fine-tune that care plan. So it's important to write things down, don't leave things to chance. And also communicate openly. So maintain regular communication with the mental professionals to address questions or concerns. The worst thing I think for a carer to do or family to do is just sit there in silence when it comes to care plan meetings, or they're given a care plan and they don't feedback. I'm not saying that's always the case. There are situations when the carer is just screaming, almost just screaming, and they're feeding back constantly and then not getting any response. So trying to get that balance, but it does, again, communication is key here. You've got to make sure that plan stays effective. It's a pathway to follow. And lastly, encourage participation. Whenever you can, it's their care plan, to be honest. So, and you want them to be independent. So you're not sort of put upon. You want your loved one to participate in that decision. It is their decision. And there's situations where they don't want you involved. Well, that's fine in a sense. But if they're independent, if they're given that chance to be independent, then they can get on with it. And you can be in the background, and when you're needed, then perhaps you can help with that. But encourage participation. That's the best way to go. Whether it's decisions and activities that support your loved one's well-being and fostering a sense of autonomy. That's that independence. So to sum it all up, your mental health care plan is a valuable guide for navigating your caregiving role with a clear direction, resources that's mentioned in that care plan, and support needed for both you and the person you care for. So with that care plan, you can both work together to create an environment that promotes stability, respect, and mutual understanding. But I hope this sort of lecture has been useful for yourselves. Do put in the comments what you think is useful for care plan, or what you think the care plan can fall down upon. I like to see others learn from each other in the YouTube lecture. And again, if you want to go through this again but not really watch the whole video, I will draw this up in a blog. Do check out my channel, The Caring Mind. And lastly, do give the video a like. It helps get more views, and feel free to subscribe. Thanks for watching, and remember to take care of yourself if you are caring for someone living with long-term ill health.